Good afternoon, ladies and gentlemen. We're calling the meeting of the Rutherford County Benefits and Insurance Committee to order. And you have before you a copy of the last meeting's minutes. Do we have a motion?
Motion to approve.
Dickerson and Mr. Hall second, and Mr. Seller second. Did anyone have any corrections or additions? All right, then, everyone in favor of that, please say aye. Aye. Any opposed? Thank you very much. Now we're going to let Ms. Stinson tell us about the financial condition of our risk management department.
If you refer to Fund 264, we'll start with that report for today. For the month of April, the per employee per month is $853.56. That's compared to same time prior year of $652.82. When you combine the on-site medical clinic experience for the month of April, that brings our total per employee per month to $903.81 compared to prior year of $704.42. Currently, year over date, we're at a 16.1% increase in our spend. If you'll go to Fund 266, we can walk through our experience on the OJI program. We currently have 20 open worker comp claims. Year-to-date total is $903,207.21, slightly up from prior year, which was $765,395.
Does anyone have any questions of Ms. Stinson? Ms. Stinson, Ms. Hickerson?
Just a little information on that first sheet with the $853.56. Is that more usage or higher dollar charges from the physician's part?
Sure. That's a good question. If you'll look at the first column of that spreadsheet, you'll see where it says self-funded claims. As an example, for the month of March, we were at $3,188,326.95. For the month of April, we're up to $4,116,448. So there was a substantial increase from one month over the other, and that is based on utilization in the private community. So that's all the insurance that passes through Cigna is what's reflected in that number. Our population remained pretty flat. We were at 5,096 in the month of March. We're at 5,095 for the month of April. So it's purely driven on services.
Other questions? We don't see that trend improving right now, do we?
No, sir, we don't. Actually, what I expect to see is typically we'll see a slower utilization of our on-site medical clinic over the summer months. And I would suspect to see that we'll probably see an increase in cost during the summer months simply related to utilization. We may see some offset of that through the private plan spend, but that's typically what we will experience. And then we'll see another blip during the colder months as well because there's a higher utilization.
Oh, Mr. Hall, excuse me.
Yeah, it's really hard to speculate. You know, one of the things that we talked about when we discussed the rate increases is how well our trend has done year over year. So what next year holds is really hard to say because we don't know what conditions. What we can do is to manage to those conditions. So some of the wellness initiatives that we're doing, like our angio screens and our mammography and those early detection type services, is what's going to help to control our spend. So we're constantly managing the data that we have available to see what we can do for adjunct services like that to help to keep the total cost. You're going to have routine expenses, though. We want to see our wellness dollars high. We want to see some of these preventative services that we offer through the health plan being utilized. has. So you want to build in those costs, but these chronic conditions, we want to keep those costs capped and not see them grow. But, you're always going to have those catastrophics that are going to drive our numbers. And we have a couple in this mix this year that's driving the numbers.
Okay, any other questions on that report? And you can see that a few, and we do have a few catastrophic claims which are pushing this envelope here substantially.
Correct.
That's the nature of insurance. And previous to this time, we've been a bit fortunate over several years, and now all of a sudden, it's turned the other way for a while.
Right, you'll see that the experience will run kind of on a bell curve, and we're just unfortunately at the top.
Okay, the next on the agenda is a wellness update, and in the absence of Kelly, Ms. Stinson's going to give us that update. I'm sorry, I'm one item ahead on the agenda. All right. Mr. Good, will you tell us about workers' comp and OJI then?
Afternoon.
Afternoon.
For the month of April, we've had a total of 22 injuries requiring medical attention. As you can see, the breakout there on your report. That brings the total for the year to date, being January the 1st to the end of April, of 61 total claims. Of that 61, 45 are OSHA recordable. 25 of those claims had restricted days, 6 were lost claim days, and 14 were all others. If you look at the next page, you'll see what it looks like this year as compared to the 2 previous years. And we are down presently, as you can see there, for the claims for this year. This year being in the small triangle, it's in the 2 previous years in the bar graph. Of the 22 claims that we have in the month of April, the total incurred dollars for those claims at this time is $46,425. The county general had 5 claims, and the dollars incurred for those 5 claims was $23,975. And the remaining claims were with the Board of Education for a total of 17 claims, and their dollar amount incurred is $22,450. On the next page, I have been requested in the past to break out those county claims, and you'll see those 5 claims broken out on the next page as to where they are in the different departments. And that's all I have at this time. Do you have any questions?
Questions of Mr. Good? Okay, thank you for that report there then. Appreciate it. Now we're ready for Ms. Stinson to tell us about our wellness.
I know Ms. Perrin is disappointed she wasn't able to be here today. They've had some great experience in the month of May with our wellness programs. We did roll out 2 mobile units during the month of May, including the mammography and the angio screenings. We had tremendous feedback from the employee population, both in terms of this, we had a full calendar, and we have received emails of accolade about these mobile units. So I think that we've done something good for the population. We had 40 in attendance at the mammography. We had 75 attend the angio screenings. The healthy cooking class featured fajitas this month, and we had 12 in attendance. We had a 20% discount off of lane trains and automobiles as our wellness discount. Through the addition of a wellness person at the actual MedPoint clinics, we have began individualized coaching, which you'll see as a new category on this report. Ms. Cook was hired in April, and we had 10 people come in and visit her during the month of May. We had a 33.3% return rate from those initial visits. So we were able to have the individual coaching with them, set up some goals, some follow-up visits. We had a 33% return rate. And for our population, the number itself may not be big, but that percentage is impressive for our population. So that tells me that people are open to the behavior change, and we're going to push that forward. The upcoming activities that we have is the free skin cancer screening scheduled for June the 2nd. There is a Relay for Life walk run on June the 15th. We have our first Wellness on Wheels, which is the program that Ms. Cook and Ms. Perrin will come to an actual facility site. So if a department head wants to offer something for their employees, they will actually come and set up and cover some type of health-related topic for that employee population. There will be one here in the courthouse lobby on June the 20th that employees can attend, and it's going to be about sun safety. There's a lunch and learn featuring CrossFit at the health department at 11:30 a.m. on June the 26th.
Any questions about any of those activities? Ms. Stinson, I think it might be good. I mean, I heard a little bit of feedback about this angiology screening business. You might want to describe this to this group and to the public and what that really entails.
So the angio screening, it takes about 20 minutes. They actually give you a 3D view of your arteries, and it shows whether or not you're getting plaque buildup and things along those lines. It is a good initial preventative step that can be taken for you to identify whether or not you need to be referred out to a community provider. So as an example, someone with a family history of cardiac problems, this is a great test for them to have. They can come in, they can see whether or not there is any initial plaque being built up, and then they'll know if they need to refer out. Also, over a certain age category, it's an appropriate test. I know that several of us here in this room have had it done. I've personally had it done. I was quite pleased with the level of information that it provided to me, and having a strong family history of cardiac, it gave me some peace of mind going forward that I had taken that preliminary step in self-management. So.
And there are others that found that they needed to go and continue this process of seeing an actual physician to determine what other course of treatment might be necessary. So it's going to identify any number of people that need to start being proactive and being preventive in some of these difficulties that might be progressing.
That's correct.
Okay, that's a good program, I think. All right. Now, the next agenda item is regarding long-term care insurance, and Calvin Benefits is going to give us an update on that, and I believe Jay Brown will explain what has happened here.
I'm Jay Brown with Calvin Benefits, and essentially our role in the past has been to help place your ancillary benefits as well as be an extension of HR during open enrollment time to communicate the benefits to the county school employees. And really what we're trying to focus on this year is looking at the long-term care with a life rider with it. Back in 2010, one of our main roles that year was to focus on the HRA medical plan during the open enrollment meetings. And then we scaled back the voluntary benefits, really just trying to focus on the cancer, accident, and critical illness plans that you offered, and try to focus on really trying to increase the participation so that we could keep the requirements that the insurance companies put on us to that higher level. And the goal was to offer some additional products in future years. That very next year, your life was up for bid, and so we did analysis on that and made the decision to change carriers and really focus on the life insurance that year. So it really didn't make sense to offer any other products that year. And then last year, you were still having a very good medical utilization, as we were just talking about. And so the past 2 years, we've been fairly light on doing open enrollment meetings. But this year, with your change in utilization, as we talked about, we are making some medical and dental plan design changes. So we are going back out to all the locations this year and probably going to do over 75 group enrollment sessions. And in those sessions, we want to take the opportunity to look at another product that really the employees have inquired about over the years and something we wanted to roll out. But with this product, it really needed to be more in a group session. And so this is the first year since the first year we worked with you that we were going to really try to focus on more group sessions. And in that session, talk about a long-term care product. And really the inquiry there is that product will help you if you're getting into a nursing home or assisted living type facility. It'll help with that benefit. Another thing we had questions and inquiries about was more of a pre-needs benefit or like a funeral home benefit. And so when we did the analysis and looked at this, we looked at several carriers, several different products, and the one that kind of matched the two together was a Fidelity Life product, which is a life product, a level term life product that has a long-term care rider with it. And the key with that is there's no minimum participation requirement. All the other products we looked at did have some type of participation requirement. And so with this one, that kind of helps with the enrollment process. Really, what we've negotiated with them is that as long as we're doing group meetings, we offer a group questionnaire, and that the employees that are interested in the product, Fidelity Life will have somebody come out and talk to them one-on-one about what is long-term care, why is it important, what type of product do you need, because there's different options you have available. And then as long as we go through that process, they will guarantee that we'll be able to offer the product at the end of open enrollment. So that's a product that we'll be offering this year, and we really want to take this time to make sure you guys kind of had the preview of what the product is and the enrollment process, and see if you had any questions about that.
If I could add just a couple of things to Mr. Brown's comments. I have been approached, as Mr. Brown indicated, a couple of different times about the need for a long-term care product in our benefit portfolio, which is the spectrum of benefits that we offer. Additionally, I've been approached about a pre-need. And what this particular product does, and as Mr. Brown indicated, we went out and Mr. Brown actually went out to the market and accepted several different quotes for long-term care. What we found is that this is the best product for employees because it does a couple of different things. One, it gives them that long-term care benefit that I've been asked for. Secondly, it gives them that pre-need benefit that I've been asked for. But third, and probably the most important, is sometimes people are hesitant to purchase a long-term care product, not because they don't know that it's the right thing to do, but because they're afraid they'll make that financial investment over the next X number of years, and then they may not ever have a need for it. There is a guarantee in this particular product that Mr. Brown discussed, in that should you pay your premiums over the course of the years and you're fortunate enough to never need long-term care services, then there is a death benefit available when the time comes for your family. So you're not paying all of these years and not accruing some type of benefit at the end. But whenever I had met with Mr. Brown, and I brought up the need for long-term care, he actually reacclimated me to prior discussions he had had with Ms. Miller whenever she was here, that this was a product that had been reviewed, but as he indicated, the timing wasn't right for the marketability of it, because a lot of carriers will require that you have a certain participation rate. And we know from historic purposes on our ancillary products that we would not have met those participation rates. So now is the time for us to bring this out to market because of the 70 open enrollment meetings that we're going to have. We're going to be able to actually reach the employee population that is necessary to be able to not only offer it, but to get the enrollment level where it needs to be so we can actually go in and bring that product to fruition for those employees that want it. So we just wanted to make you all aware today, because I know it may have been a while since we've had this discussion.
Ms. Stevenson?
Are there any exclusions on the death benefits? You say if they pay towards the premium but never have a need to actually use the long-term care, but something occurs, are there exclusions to the death benefit, such as, is it just for accidental death or?
Question. I mean, the one good reason about this product, it's a term benefit, so it actually stays the same face amount all the way to age 121. I don't know where they came up with that number, but essentially it is to life. And so when we looked at this, we had a big increase in supplemental life insurance when we rolled that out a couple years ago when we changed carriers. But with the supplemental life, what we see is that at age 65 to 70, depending on the product, the benefit starts reducing. And then it reduces down about every 5 years to whatever you purchased, maybe younger in age, it reduces to about 50% of that benefit at some point when you're probably going to use it. And with this benefit, it'll stay flat. Typically, the two levels that we're looking at is a $25,000 benefit or a $50,000 benefit. So this really isn't going to replace the supplemental where you may have purchased $200,000 of coverage. This is really in place to help with pre-needs. It's $25,000. So if you were to pass, when you are to pass away, that amount didn't reduce, and it should be able to cover all your funeral expenses and things like that. Plus, with this plan, as long as you pay up to 5 years, you pay into it for 5 years, whatever amount you've paid in there, and then decide, at 6-7 years you can't afford it anymore, you don't want it, you still keep some form of a benefit at that time. Now, to your other point, what this rider has in there is it does have a long-term care benefit tied with it. And so if you are put into a nursing home or assisted living facility, or you have home health care, it would pay a portion of that benefit for up to 25 months. And after 25 months, really at that point, you've exhausted the life benefit. So it's really kind of one or the other. Where long-term care, you may never need that, and so you paid for nothing. With this one, you're paying that amount, and say, for instance, you do use the full 25 months of the long-term care, then that benefit would go away at that point. So it is kind of a one or the other. And I don't know if that answered fully.
Portable, though, if the employee leaves, it's something they could take with them?
It's portable at the same rates, because a lot of times with life insurance, it's portable, it's higher. It's portable at the same face amount and at the same rate that you pay today. And on average, it's 100% employee paid benefit, so there's no risk to the county. But on average, a 40-year-old non-smoker male for this product is going to pay about $4.50 a week. It's kind of what it is, just as a range. And that covers you for essentially a 2-year long-term care policy or as much as a $25,000 life policy, depending on what your needs are at that time.
So, Ms. Stevens and Mr. Brown, this is an additional opportunity, you might say, that's going to be offered to our employees, and they will be paying this if they so choose. I mean, it's their choice, and they pay for the full cost of this.
Yes, sir, that's correct. And I think it's a fundamental piece in financial planning for a lot of people.
I can assure you from already personal experience that these kinds of policies, you expect you and hope you'll never use them, but I already have. My mom has been using one of these policies for years, and my investment in that policy over a period of 10 years has already been repaid tenfold. So I can assure you that it is something that most all of our families are going to unfortunately experience due to the fact that we're living so much longer, and it's going to touch more and more of our lives.
And the reality is, I know in the private market, for an individual long-term care policy, some of the actuarial tables are not holding true, and they're taking substantial rate increases. When we consider, I'm always trying to look at the budget of our average employee, and when we look at it, they would be priced out on an individual long-term care policy, but this is an affordable policy. And it is an investment that will reap some benefit at some point to either themselves or their family.
We've rolled these type products out a lot over probably the last 4 years, and the key will be getting the employees to the meetings. We'll only have a few slides just to get their interest, but with this, you have to get them to the meetings to hear stories like this. Everybody in the room will have a story like that, a mom or a sister, but we have to get them at least to come to the meetings and fill out the interest questionnaire. And then if they're interested, we'll have one of the counselors come out and talk to them one-on-one, but really as far as being able to offer it with no minimum participation requirement, we really will have to try to push to get more people in the meetings, which we had a great turnout in 2010 when we had the push for the health reimbursement account. Last 2 years has kind of been slim, but I think with the medical changes this year, we're going to get a lot more participation anyway.
Got Ms. Harvey and then Ms. Hickerson.
Couple of questions. Are they taking into account your health at the time that you purchase the policy? Is that going to affect the rates? And second, when will this be introduced to the employees? Will it be during our open enrollment insurance time and go into effect January of 2013, or when will this happen?
First question, that's kind of back to the enrollment process. As long as with Fidelity Life we agreed to do the group meetings and do the interest questionnaire, then they've agreed to waive medical questions for the employee. So there will be no medical questions for the employee. You can also enroll in this product for your spouse or your children. There's limited, I think there's 5 questions they ask for your spouse. Have they been hospitalized in the last 5 years? So just some basic questions to approve your spouse for that plan. As far as the rollout, it will be during open enrollment here in the fall, and it'll be effective January 1st of 2013.
Did that answer your question, Ms. Hickerson? And I suppose the rate will be age dependent, though. Depending on your age when you take this, it'll be a different rate.
And the key with that, too, is you're locked in. I have a long-term care policy myself. You're locked in at the rate that you purchase. So if you purchase it obviously younger in your life, that's the rate you're going to have. It's unlike the supplemental life where it bumps up every 5 years. This rate where you lock it in is where it stays. So that's another positive of trying to get in there.
Any other questions? All right, well, that's good. So this is just for information, and this will be part of the offering with the open enrollment period. Thank you, Mr. Brown. Is there any other business that needs to come before this body today? Ms. Stinson, anything else?
No, sir, not today.
Okay, well, thank you very much then. The meeting is adjourned.